Community Health and Transcultural Care Nursing, Chapter 6, 7, and 8, Environmental, Legal, and Economic Influences, Sandra Monk. Okay, first we're going to begin with Chapter 6. Okay, and we're going to talk about the historical context first. And environmental health is deeply rooted in nursing, and that began with one of our nursing founders, Florence Nightingale. And public health is strongly based on her knowledge and her writings, and the writing of and experiences of some other public health nurses also that we talked about when we talked about historical nursing. But Florence Nightingale being one of the most predominant ones, and she wrote about the quality of the environment and recovery from illness, and she said there was a great importance for clean air, water, food, good drainage, cleanliness, and good sunlight, and that people could heal if they had these things. She wrote about those things and actually did research. Lillian Wall and Mary Brewster were very influential in public health nursing in the Henry Street settlements where they promoted environmental health. And then environmental health science, it is very much scientific, and so there are some scientific definitions that you need to know, toxicology being one. And toxicology is the basic science that includes the study of health effects with chemical exposure. And this is only talking about the negative effects of the exposure, and those are the only ones that we study. And as nurses, we should be aware of what some of those are, like lithium batteries, lead, exposure to mercury, gases such as ammonia and carbon monoxide, and pesticides. And then epidemiology is the study that studies poisonous effects of the chemicals only, and the strengths of the effects between the exposure to humans and the health effects. It examines the works related to illnesses such as tracking the flu, lead poisoning, unsafe water, and air pollution. And then the epidemiological triangle, we'll talk about a whole lot more in Chapter 9, but the definition of that, it includes an agent, a host, and the environment. And of course the agent is the chemical that we're exposed to, and then the host is the individual or the community, and it takes into consideration aspects of human health related to age and gender, ethnicity, and all the diseases that are in the environment. And then the environment is air, water, soil, temperature, and humidity, and we're going to talk about how to assess that. And environmental health science is very much a multidisciplinary approach, and nursing is part of that interdisciplinary team or multidisciplinary team, and it includes scientists. And so strangely enough, scientists like meteorologists, geologists, as we look at global warming, we look at conditions of the weather, and then housing inspectors and laboratories. From a historical, oh, we already did that slide. Sorry about that. From a environmental aspect, we will be doing an assessment. You'll be doing your own this semester, going out and doing that. And you will begin with a wind chill survey, and it's just like it sounds. A wind chill survey is the first helpful step in understanding the potential risks within a community. It was like what you would see as you walk around or you look around within the community. And it would be different. An urban community would have a very different, distinct problems and opportunities than a rural community might have, and the same in a rural community. Air and indoor air quality is really of a rising concern because of the increase in asthma, particularly in children, but also in adults. And major air pollutants are regulated by the Clean Air Act also. Water, fresh water is a very precious commodity. Our book points out how that we have there's only like a little over 2% of our entire water supply is actually fresh. That comes from the polar ice caps, and also from some streams and other bodies of water. And then land, past and present use of the land can impact the environment. What was built on that land, I know we've had things right here in Macon that they couldn't build on certain land because of what was buried and stored there during the time that it was a manufacturing company or it was a storage company, or that's where things were stored just because it was was convenient in a place, to keep them toxic chemicals. Food-borne illnesses such as salmonella and E. coli, consideration of like huge lots where animals are kept prior to being slaughtered for consumption. And a nurse, also social like employment and hobbies. I'm going to show you an acronym on the next slide that will help you to remember what you should assess when you're doing this. And a nurse completing a full assessment would also have to ask about occupation, what's your longest length of employment. And I prepare is that acronym. I stands for investigate. You would investigate, what all was going on in this community. P is present work. What kind of present work are they doing? Is there some kind of chemicals that they're exposed to, or other type of work? Work risk that might be involved with, being exposed to lead or other chemicals or equipment that might be unsafe. What about their residence? Where do they live? Is that safe? Does it have environmental issues involved with it? Environmental concerns, your air, your water. Do they have safe water? Do they have running water? If they have running water, does it come from a safe source? Sometimes we will limit water based on if there's like a lot of flooding in the area, because then we know that the groundwater gets in with other water or drinking water and can't be consumed safely. It has to be boiled. What type of activities? For example, a person who is even who does stained glass work, they might be exposure to lead. They might be a welder. And then referrals and resources, and we're going to look at what some of those are, at least some of the financial resources. And then you want to educate the person. And do they then need to be referred on to a healthcare practitioner or other something to help them find safe housing, some type of financial counseling or some type of economic counseling. Right to know, consumer confidence reports, also known as right to know reports. And I think about right to know when I think about material safety data sheets, because that's how they were brought out to us, when they first came around. I guess like in the 1990s. And consumer confidence reports also are related to things like drinking water. Like you can have so many particles of contaminants within drinking water that it's a legal amount. And so you need to, know. You can look and find out what it is for your particular area. And then the MSDS, they have 16 sections with things on there like the name, how do you store it, what do you do for a spill or contamination, how do you dispose of it, how do you transport it, and so forth, all the different specifics about that chemical. And then the risk assessment is the process of determining the risk and threat associated with an exposure. And then on 102, it talks about risk communication. What should you communicate? Well, you should always communicate the right information to the right people at the right time so that people are able to make decisions. It needs to be accurate, relevant, in a language that people can understand. And it needs a good risk assessment has all the essential ingredients of this, or all the essential components. And the right people are those who are affected, or even people who aren't affected who may be worried. We need to communicate with them, and at the right time we need to have timely action, and also just to relieve fear so that there's not high amounts of anxiety. Influence of the environment on children is very important. Important concept of community health nursing is how do we care for our children. And children are more likely to live in poverty, and some children don't have access to adequate health care, and they may live in dangerous environmental situations in a certain part of the country. We don't have adequate affordable housing, or we don't in certain places like out in rural areas not far outside of Macon and even inside of Macon, there are a lot of older homes that people continue to live in because that's what is available and affordable to them. And the main problem with children is is their immature systems, and they're smaller in size, and they are closer to the ground, and then they can get contaminants more easily, and also their kidneys are immature and don't filter fluids as well as adults. They breathe more often, their respirations are more frequent than an adult, adult, and they drink more water. Their body is composed of more water, and the blood-brain barrier is not fully developed. Therefore, something that an adult might be exposed to lead, and it wouldn't be, as dangerous as a child who might have learning disabilities or become neurotoxic. And then environmental factors and health conditions. We talked about that genetic predisposition. Autism has increased 100% since the 1980s. Childhood obesity has skyrocketed by 3 times in 30 years. Children have increase in leukemias, and yet stringent rules that apply to buildings for schools and daycare are less stringent than they are for children than they are for like hotels, motels, and other public buildings. Reducing environmental issues, I have said this, and I'll say it probably lots more times, that preventing a problem is less costly and has less negative impact on health and on resources. Disease prevention and environmental prevention should be put into place. Incineration can change how a chemical composition through heat and turn it into air pollution, and like ash and smoke, it can be carrying air pollution with it. Water must be treated so that not too many particles of contaminant per molecule are allowed in that water source. And then landfills and burying things in the soil is also, we know, dangerous, but it was a practice that went on for a lot of years, and we are not always able to build over landfills because of the escape of methane gas. And also we either have to have ways to store or dispose or alter chemicals so that they are not dangerous to the environment. Environmental laws, the Clean Water Act, there's a bunch of them in your book, but I'm just going to cover these 4, which set basic structure for regulating pollutants in the U.S. waterways and water storage in the United States. The Clean Air Act, it controls the emissions from stationary and mobile sources, so that's both factories, cars, boats, planes, all of that. And industry needs to work to and whenever they have to work on plans to always have the worst place scenario in place when they are producing something or transporting something, to think about what they would do in the case of spills and storage or contaminants. I mean, you think about the Valdez, where all the oils were on the banks of the United States, and that wildlife was contaminated, but what future contaminants might we have from the oil spill that was in the Gulf in years to come. Oh, let me go back and cover a few other words on that slide. I'm sorry. I didn't cover OSHA, which is Occupational Safety and Health Act, and that ensures a safe workplace for employees to free from hazards and health and safety such as chemicals, noise, mechanical dangers, heat and cold extremes, and unsanitary conditions. And then the PPA is Pollution Prevention Act, which reduces the amount of pollution through cost-effective changes in production operation of raw materials, and focuses on recycling and efficient use of water, energy, and sustainable agriculture. Roles for nursing environmental health, community involvement includes individual and community risk assessment. The nurse may be involved as a member. This is an example. She might be involved, he or she might be involved as a member of the local health department that after, as a follow-up to maybe a restaurant that had food poisoning, and he or she would go back out after compliance had been set into place, and just make sure that they're maintaining compliance. Individual a nurse who wishes to be involved in reducing environmental pollution could be involved with reduce, reuse, and recycle. Could educate people on that, also practice that themselves. Those are the 3 R's for reducing environmental pollution, and that's something that we all should try to do. And a nurse wishing to be involved in risk communication would ask questions maybe at a local policy meeting, or serve as a source of information for the same meeting. And my students and I attended a meeting about the spread, about how to care for Ebola patients in the community down in a rural county where they're less likely to be seen, but they might present there and then need to be transported to another county that can handle that type of health care. And so the nurses were there from public health, people from EMS, people from physicians' offices, people from the mayor's office. I mean, a lot of people from the CDC were there discussing that. Epidemiological investigations are having the skills to respond in a scientific and sound way to community concerns about cancer, birth defects, stillbirths, flu vaccine, and things like Ebola. Policy development is proposing, informing, and monitoring actions from agencies, communities, and organizational perspectives. Chapter 7, and we're going to get into that. Then government law and policy activism. What is healthcare policy? And healthcare policy, healthcare policy is a settled course of action that will be followed by a government or institution to obtain a desired effect. And then health policy is a set or a course of actions that to obtain the desired health outcomes. So it's by a government or institution, and it is for individuals, families, groups, communities, and even society. And then politics is the art of influencing others to accept specific courses of action. We're always trying to get our programs accepted and our influence about things that would influence our community. Law is a system or privileges by which people solve problems based on a set of established rules. And nurses who select community health really need to be aware of the impact of government law and healthcare policy on nursing and on the health of the people that they practice with. So they need to know about political action, and they have been public health nurses have been very involved in that through the years. Why does government become involved in healthcare policy? Well, that's a good question. It is to provide for, this is the main reason, it says it lots of times here in the book, to provide for the general welfare of the people. It began way back, when people first came to the United States, that they established methods of maintaining the welfare of the people. When they needed to set up ways to maintain their settlements in a sanitary way to dispose of waste and so forth. And then police power is the power that allows states to protect the health, safety, and welfare of their citizens. And it has to be used fairly. For example, immunizations of children before entering school, finding and following up on TB. Those types of healthcare crises and impending healthcare crises, are looked at before even some other type of preventive measures. The Social Security Act of 1935 was put into place to take care of elderly people. Most people didn't even live to age 65 in 1935. And so now people are living longer. There are more of us over age 65, with people, not me yet, but people who are over age 65 beginning in 2011 with the baby boomers, the first one turning 65, and that's going to continue for the next 30, 40 years that we have that large number of people turning age 65. And then the Centers for Medicare and Medicaid was set up to be an insurance, if you will, for Medicare, which are persons over age 65 and persons with certain disabilities and illnesses, and then Medicaid, which is income eligible and for children. And I'll tell you a little bit more about that program in just a minute. And then the Affordable Care Act of 2010. And I just want to talk about that a little bit more because that is a pretty important. It's going to have a big impact on your practice as you begin your nursing practice. And why do we have the Affordable Care Act? And the purpose was because there was felt that there was abuse of insurance against consumers, that insurances were charging more and offering less, and it was to contain cost. Therefore to make money. That was that at least is the impression. And so it also was to hold insurance companies accountable and to keep premiums down for pre-existing conditions, because what started happening and people were excluded for cardiac diseases, for children with birth defects, all those types of things were they were excluded, and so it caused people to have catastrophic health care bills. To make health insurance affordable for the middle income, it seemed like the very poor could have Medicaid and have some safety net insurance, but and then persons who are very rich could either pay out of pocket or they could afford the insurance premiums. But the people in the middle, it's becoming more and more difficult. And then to provide security of continuous coverage for job changes, because the COBRA insurance didn't really work all that well because it cost as much as a month's salary for most people, and so most people didn't even elect it, and so then they just would gamble, and if they had a heart attack in the middle, they just would either have a huge bill or maybe it would be time for their new insurance to click in, or they'd still have that 60-day grace with COBRA. So it really wasn't a great insurance coverage for people who are changing jobs. And then to strengthen the Medicare Part D, Medicare Part D was made allowable for persons with Medicare to pay for medications. Those used to not be paid for at all. Now they're paid for, but people who have a high medicine bill, say $500 or $600 a month, they go into the donut hole about the middle of the year. So it's supposed to help with that. And then also to reduce the national debt by persons, not using emergency rooms and not becoming so sick that they could not afford to, and then it costs more with their illness. Organizations and agencies that influence health, the World Health Organization, the WHO. They are in Geneva, Switzerland. As you know, if you're in Switzerland, you are very neutral, so that is where that's located. Not sure that's why. That promotes health and cooperation in global health policy, and they also help disseminate information and research. One of the ones that I think of that you'll hear quoted all the time is the World Health Organization's statement on pain. And it talks about, and then they have the World Health Ladder of pain, how pain should be managed with different levels of pain medications. And so that was developed through research, and it's been disseminated globally. And then the WHA is the WHO's policymaking section. Then the U.S. Department of Human Services they take care of the health and welfare of the citizens. And then the Health Resources Service Administration, HRSA, they help provide funds and programs for health professions, underserved areas of the United States. If a person were to train to be a nurse practitioner or a physician, for example, they might get some of their tuition forgiven for working in an underserved area, and that would be administered by HRSA. Centers for Disease Control and Prevention, you've all know that. It's located, the national is located here in the United States, parts of it. There's other parts of it that's all over the United States. Has to do with disease control, research, and prevention, surveillance and monitoring of diseases, which is a huge with the number of people who live in our country. And then National Institutes of Health, NIH, is a big, is a rigorous research organization in addition to the National Institute of Nursing Research, the NINR, and then the Agency for Healthcare Research and Quality, AHRQ, and then the Centers for Medicare and Medicaid Services. AHRQ, that is where your clinical practice guidelines are. So say if I wanted to find out about a child with asthma and I wanted to find out the most recent information on that, I would go there and I would look and I would see about, the MDIs and the, what recommendations there are for providers and for parents, and medications and so forth. So that is what the AHRQ is, and we've already said what Centers for Medicare and Medicaid are. Organizations and agencies that influence health. There are some federal non-health agencies, such as the Department of Defense, that they manage and monitor and fund the health of military personnel and their families. And then the Department of Labor. The Department of Labor, you wouldn't think about that, as much, but they manage OSHA and Mine Safety and Health Administration, so they're looking at workplace safety. Department of Agriculture, you'll think that they were out inspecting food, but not so much. They are monitoring and managing food and nutrition services. They also monitor food stamps, issue food stamps, WIC, which is nutritional assistance for women and children who are have nutritional deficits, have a low hemoglobin, and also are income eligible through the health department. That's where it's dispensed from. And then the school lunch programs. And then the DOJ, or the Department of Justice, is federal prisoners and other prison health services. Okay, impact of government health functions and structures of nursing. There's a variety and a range of functions and governmental agencies that have had an impact on the practice of nursing, and that's particularly related to funding. It's sort of shaped the roles and what public health is going to look like. And that is because that the designation for funds go for specific needs, and it leads to very narrowly focused nursing roles like just emergency preparedness, or just school nursing, or just family planning. And so this categorical funding, as they call it, the money has to be used for the population it was intended for, and the funds from one can't be used for another purpose. An example I give of that is in Head Start. Head Start is funded by Head Start grants through the federal government, but also through the health department does perform some of the health services, and WIC performs some of the health services, and none of those are really coordinated. I mean, somebody has to really look at, make sure that the child is getting all the services, but it's not a one-stop shop to get those done. Chapter 8, Economic Influences. There's a link between poverty and poor health outcomes. You'll hear me say that lots of times, that socioeconomic is just a huge contributor to poor health outcomes. And nurses who are in the community and practice in public health nursing, they've got to be aware of all of this impact. And we talked about this some last week in chapter 3 even chapter 5 about the approximately 97% of all healthcare dollars are spent for individuals, while only 3% are spent on population preventive level healthcare. And the U.S. spends more than any other nation on their healthcare, but the quality is not necessarily there. And the current healthcare system is a point where it's really not affordable. And so it's really, you've got to be knowledgeable about programs like this. And one of the greatest challenges in this century, and I think I have it on another slide, will be in an emergence of new and old communicable disease processes like measles, chickenpox, Ebola, smallpox, and so that is the concern, with public health. Public health and economics. Economics, some little definitions there, is a science of concern with the use of resources, including the producing, distributing, and consuming of goods and services. And health economics is concerned with how scarce resources affect the healthcare industry. And we all have scarce resources, even though we all are on a limited income as far as we can only afford to make so much money, or only have enough time and energy to make so much money. And then public health economics then focuses on producing, distributing, and consuming the goods and services as related to public health. And then factors affecting resource allocation in healthcare. We talk about the persons who are most likely to experience a barrier to to healthcare, just can't get it, are the uninsured and the unemployed. Persons uninsured are, those are, most likely they're like agricultural workers, food service workers, part-time employees, the very young, and disabled, not receiving disability, or unable to work. And like people who work like at Walmart, Target, and I'm not just saying those in particular, but types of retail like that, they may not be able to get into a full-time position and get insurance. The very young, the disabled, and those persons not receiving disability, because it takes a long time to get on disability. Once a person gets disabled, it takes them a while to get on disability. And so that low socioeconomic status is related to all of that. And then we talk about rationing of health care. What does that mean? It means that health care, the person has reduced access to care and potential decreases in the quality of services offered. For example, physicians' offices may not accept Medicare and Medicaid. They'll only accept so many to be able to keep their business going, and also that they get reimbursement. And so that is a form of rationing. And inability to pay may be a form of rationing, as some healthcare services will not treat persons without insurance. They'll just say, we don't accept new clients without insurance, because they know that they may bill and never get paid for it. Primary prevention, one of the major factors that affects health and personal behavior are lifestyle, environmental factors, so lifestyle, environmental factors, human biology, and the healthcare system. Medical services are said to have the least effect, and behavior and lifestyle changes have had the greatest effect when persons are ill or in the development of illness. So we're still spending all those dollars on tertiary and secondary care and less on primary care. Some of the challenges for the 21st century, in addition to old communicable and infectious diseases, these are predicted: larger foodborne disease outbreaks, concerns about acts of terrorism, chronic disease, as we know that there are larger numbers of persons with degenerative and chronic diseases, maintaining and getting involved with electronic medical records. We said last week that has not been fully integrated. Labor force changes as few people are working and more people are using services. And then changes in nursing practice. Is it going to become an entry level for a nurse practitioner to have a doctorate of nursing practice, since they are predicted to be the leaders of healthcare in the future? And then the Affordable Care Act. And then some trends in healthcare spending include that given economics in general and healthcare are concerned with resources and decision making, any discussion about economics, we have to look and see what happened in the past, and then also look about things going forward. An example of that is that many children prior to the 1950s and 1960s were born at home. More children were born at home with better outcomes. But with and I think I've given you this example before, with the better access to obstetricians and hospitals, women started having babies in the hospital with not as good outcomes for the mother or for the babies. So we just need to look at our past to see, what direction we should be going in the future. And past spending reflects past decision making, and that also reflects the values and beliefs held by the society. And policymakers have to, they have to listen to that, and then we have to, make sure that we are, using our voice to influence that. And factors influencing healthcare costs are the demographics. We've talked about those a lot, those demographics, the people getting older and with more chronic diseases. Technology and intensity, since the 1950s and 60s, our technology has grown astronomically, and we provide life-sustaining treatments for persons, even if it doesn't necessarily provide quality. So what direction do we want to go towards that as a society? And then of course the influence of chronic illness. Types of financing for healthcare. Medicare, we've already said that was for older persons over age 65. There also are Medicare programs for disabled persons, also for persons who are there's a hospice benefit, Medicare hospice benefit, and there's Medicare benefit for other programs also. One I'm thinking of is dialysis, because a person couldn't afford to pay for that, nor could insurance companies. Medicaid is for the poor, elderly, disabled, blind, families with dependent children. You cannot have very much money at all and be on Medicaid. You cannot own very much at all. It's like $1,200. You can't have a dollar over $1,199 of worth to qualify for Medicaid. And you receive health services, and they also get some prescription services through that. Oh, under Medicare, they have a Medicare Part D that does pay for medications, but as I said, they go into the donut hole if they have a very big bill. Then there's public health that takes care of infectious diseases, family planning, and contagious diseases. Insurance is pays. Of course, it's paying less. It pays less now and costs more, and so that's a kind of an issue. And then part of that Affordable Care Act, the insurance marketplace. We have that kind of financing now. And then private pay. In our book says about 14% of persons are private pay. And as I said, there are physicians' offices that will not accept private pay, and that is regardless of people's ability to pay. And that is the end of chapters 6, 7, and 8. Please let me know if you have any questions.